There's a lot of dangerous misinformation being put out about the coronavirus. So we called in a leading medical expert and staff writer for The New Yorker, who's written about how to control the pandemic in his latest article. Please welcome back surgeon at Brigham and Women's Hospital in Boston, Dr. Atul Gawande. Dr. Gawande, I have to just ask, the man in the White House left Walter Reed Medical Center yesterday, walked into the White House without a mask on, tweeted, "Don't be afraid of COVID and don't let it dominate your life." Now, more than 200,000 people have died from the virus. What is the message he is sending people, and why is he continuing to act like he's not sick? He is still ill, is he not?
He is. I mean, this is a reckless and dangerous message that he's trying to send, taking the mask off, heading in and saying, "You get out there." The challenge is he is still contagious. He is in the midst of being actively infected. He is walking into the White House, continuing to question and belittle mask use, and that is not the message we need to send. Especially as we have the infection rates continuing to climb.
Joy.
So, Doctor, Trump says he hasn't felt this good in 20 years. Wow. But we know that he's on a cocktail of drugs and a steroid called dexamethasone. And some say that that can cause you to feel really great and grandiose. And are we witnessing an episode right here where he thinks he's capable of doing anything? You know, I'm macho and I can do anything. And are you worried about that particular form of behavior in the President of the United States, the leader of the free world?
When I saw the tweet, I had to chuckle. It's the best I've felt in 20 years. It's such classic steroid euphoria, as we call it. It's a known side effect of getting high-dose steroids, is that you feel incredibly good suddenly for a period of time, and yes, that is part of the picture that you're seeing when he describes that. That's not where he is with the virus. Understand that when you get the cocktail of drugs he's taking, it's because he's entered that minority group who have severe coronavirus disease. What does that mean? That means that your oxygen level has fallen to below normal, below 94%, or you have an abnormal chest X-ray, which the doctor's press conference indicated that he did. And those are, that is only 7.5% of people over 65 who get this condition. That is a group who have a almost 20% risk of death. And that is exactly why he's getting these treatments. Whatever spin the doctors or the president is trying to put on it, it is an indication of how far he is. Now, the second thing I want to add, though, is he is stable. The next stage is where you're critical and you need to be in an ICU. He is not at that stage. 65% of people who are in his stage never advance that far. So I'm happy that he's stable and showing signs that he may be on the mend, but it's still too early to know.
Doctor, one of the most talked about things that happened over the weekend was when Trump left quarantine to get into a car with Secret Service members so he could come out and wave to his supporters. Now, the concern was that it was reckless and exposed people unnecessarily. What was your reaction to this?
I have to say I was alarmed. There seemed to be 4 people packed into that car. You know, when we transport someone who is actively infected with COVID here in the hospital, and, we have to get them onto an elevator to go to somewhere, we are all in gloves, gown, goggles, mask, hood, and really fully protected against the virus traveling, because even though the president had a mask on, that does not 100% contain it. I have seen staff members get this disease. I've seen colleagues and patients crippled by this, and so it was extremely alarming to see that happening, and then to see him go into the White House with 90 staff members, as you described, who have to work with him: butlers, valets, housekeepers. You mentioned 2 of them getting infected. We have a White House correspondent's family who has a family member who's gotten infected in the chain of people here. It's hundreds. It's still an active outbreak in the White House. And I think, we have to see it that way. It's not a show of strength to to just show it, this kind of behavior.
Now, doctor, we've heard what some would say are conflicting accounts from Trump's White House doctor, Sean Conley, about the president's diagnosis, treatment, and condition. It has created confusion on the timeline of when President Trump was diagnosed with COVID. And they also tried to conceal that he was experiencing serious symptoms and had to be on supplemental oxygen. Throughout this pandemic, we have looked to doctors and scientists to provide accurate information. But now many Americans feel they cannot even trust doctors to be truthful. How does this make you feel?
Well, honestly, I felt for those doctors lined up in front of the microphone and needing to speak about their patient. Our job as a doctor is to, we represent the patient 100%. Our job is not to anybody else. But, you know, that patient is asking us to lie to the public. And, you could see on their faces that they were being asked to not tell the truth. It is not what we, as physicians, should be doing. I think we have to walk that fine line. Presidential medicine is abnormal medicine, and there is a need for the public to know what's going on. But it should not, your protection of your patient should never go so far as to mislead others about the condition.